Welcome to the final video on being autistic. Therapy, communication and environment. This should be of interest both to people looking for therapy and people offering therapy. This session will cover prevalence of mental health difficulties, autistic strengths, what therapy works, the power imbalance, communication, misunderstanding and trust, transparency and congruence, outside the therapy room, and there'll be a bit about diagnosis and disclosure at the end. Here's a rather eye-opening table from an article by Autistic. In other words, autistic people are significantly more likely to suffer from depression, anxiety, sleeping disorders, eating disorders, OCD, and also bipolar disorder, schizophrenia, and psychosis. When you factor in that many people diagnosed as autistic in later life have had a whole bunch of misdiagnoses through their lives, personality disorder diagnoses, notably BPD, are common, we could appear to be quite a daunting prospect in the therapy room. I hope that by now you might see that that is hardly surprising. We are coping with all the stuff that non-autistic people are, and in addition, difficult interactions with non-autistic people, the double empathy problem, the exhausting impact of camouflaging, negative social interactions and consequent lack of social support, which impacts upon our self-esteem and self-identity, difficulties with recognizing and regulating our own emotional experiences, for example, alexithymia, meltdown, shutdown, sensory sensitivities triggering emotional distress, executive function difficulties which cause additional stress and distress, and neurodivergence itself, having a differing cognitive style, which means that not only do we have challenges, we may also find that our strengths are not recognized or valued by non-autistic people. Here, as a quick digression, are some of the most obvious strengths that we, in general, have. I find that this works very nicely as a counter to the list of deficiencies and things that we struggle with. You could hand that to anyone who is struggling with their diagnosis, or indeed to anyone who seems to be unable to shake off the stereotype of deficiency. So, excellent long-term memory. Incidentally, many of us, myself included, have a near photographic memory. I can memorize a route map in seconds, which is the rather useful flip side of my almost complete inability to follow directions. Many of us can remember long strings of numbers. My party piece has always been, no, just tell me your mobile number, I'll remember it. Observation skills, analytical approach, profound focus, strong focus on detail. If you want something proofread or checked for mistakes, ask an autist. Passion and knowledge of chosen topics. Obviously, we are as varied as neurotypicals are, but we tend to have these characteristics as people. We are innovative and creative. We think about things differently and come up with what seem to neurotypicals as left-field ideas. A surprising proportion of us are also creative in the sense that we are artists, musicians, writers, craftspeople. Honesty. It is not quite true that autists can't lie, but on the whole, we don't see the point. The truth is the truth, and that is how things are. Why would we pretend that they are otherwise? If an autist tells you something, chances are you can believe them. Loyalty and above all integrity go hand in hand with that. In general, what you see is what you get with us, unless, of course, we are camouflaging. We don't generally do ulterior motives or undertones or arrière-pensée, except, inevitably, when we are camouflaging and trying to pass as neurotypical. We are accepting and non-judgmental. Well, we know what it's like to be judged and not accepted. Humour. Never believe anyone who tells you that autists have no sense of humour. Our humour tends not to be unkind or to poke fun, except maybe at ourselves, and it is often heavily language-based. We love puns. Autistic comedians? Hannah Gadsby, Fern Brady, Kate Fox, Michael Palin, and maybe Susan Calman. And yes, empathy. I hope I made that clear enough in the second session of these videos. All these strengths that nobody seems to list when they are talking about autistic people. Who can be surprised that sometimes we just feel like giving up? Regarding mental health difficulties, there is some emerging evidence suggesting that depression and anxiety may function differently in autistic people, which means that we may present a bit of a conundrum to a therapist who isn't listening deeply. Research has suggested that difficulty with recognizing feelings and emotions, its Sunday name is alexithymia, difficulty with changing repetitive thoughts, cognitive rigidity, and differences in sensory experience appear to play an important part in anxiety and mood for autistic people. It also seems that many of us respond in unexpected ways to psychiatric medication, and indeed to all medication. As with our sensory differences, we may be extremely sensitive to medication. Anecdotally, this is the more common, or it may have no effect at all. Most of us will have a long history of contact with mental health services, mostly unsatisfactory. Because we are not, in fact, broken neurotypicals, but perfectly good autists, struggling to live in a society not designed for us. I am aware that I am a very rare exception. For some reason, I have always known that my difficulties came from a mismatch of some kind, which may be why discovering that I was simply autistic came as such a joyful revelation and made such instant sense. It is very likely that your autistic client will present with one of these conditions. They may or may not connect them with their autism. It is useful for you to know, firstly, that there will almost certainly be a connection, and secondly, that they may not in fact have endogenous depression or anxiety at all, that their low mood and anxiety may, so to speak, be a sane reaction to an insane situation. What therapy works for autistic people is a question you hear regrettably often. Well, I have a revelation for you. Just as there is no answer to what therapy works for people, there is no answer to this one. Because, surprise, surprise, autistic people are people, and as I've said, we vary just as much as non-autistic people do. There is a really relevant passage in Naoki's Fall Down 7 Times, Get Up 8. Naoki is talking about support for children with special needs here, but I think it's a passage that every therapist should take to heart, whether or not they are working with an autistic client. It's quite long, but it is worth it. Some people have rather fixed ideas about how those of us with autism ought to be supported. If they were all as correct in their views as they believe, however, autism wouldn't still be causing all the challenges and difficulties it does. You meet people who tell us, nope, you're doing it all wrong, and every single person who attends this institute makes amazing progress. But if the latter was really true, word would spread like wildfire, and everyone everywhere with autism would have adopted the miracle method ages ago. Any given therapy method might well work to some degree for some people with autism, but no approach will work across the board for every person with the condition. By the same token, I don't claim for a second that everything I've written in my books applies to each and every neuroatypical person. When help for special needs is considered, everyday assistance or ideal environments are often raised. These matter for sure, but in my opinion, the vital aim is to nurture motivation. Not stamina for its own sake, nor patience for its own sake, nor programs offering instant results, but hope for the future, positivity about learning and practical skills, Special needs teachers and helpers who can evaluate the effects of the help they offer are truly awesome. In contrast, those who think of themselves as infallible never stop to consider that they themselves could be connected with a child's unwelcome behaviour. Please reflect often upon what's going on. We are people like you, and our moods swing along with circumstances like yours. You'll see how and why if you stop and think. Help isn't just a matter of getting us through our daily routines without a meltdown. Help varies from person to person. The help we really need might not be the help that others are bent on giving us. Events do not follow a script. This is being human. This is being human. I can see Carl Rogers nodding in approval. And so I'll answer the question, what therapy works for autistic people, with another question. Which autistic person? Research suggests that, as in the case of non-autistic clients, there is no one therapeutic modality that works or doesn't work for autistic clients. What works is the relationship. I should say quickly, though, that CBT can be problematic for two reasons. One is simply that it is a very cerebral therapy, and it relies on brains experiencing, processing, and communicating in a particular way. Autistic brains don't. A participant is quoted thus in the article by Authentistic I mentioned a couple of slides ago. I am diagnosed with anxiety, but I'm not sure that the anxiety I experience as an autistic person is the same as that experienced by people without autism. And if it's different, then I don't know if evidence-based treatments are relevant to me, since I am not like the people the treatment was trialled on. We mostly find CBT baffling and problematic. An autistic client of mine also commented, I'm quoting with permission, "Honestly, I have never heard anything suggested by CBT that I hadn't already thought of, tried and discarded." We have very analytical brains, and we like solutions and clarity. So, as my client said, we have probably already got there before the CBT therapist. A really flexible, properly client-centered CBT therapist who is actually listening may well be successful with an autistic client. But there too, what is working is the relationship. I would say, though, that it is not the therapy of choice. What works is listening and learning, and, as Irvin Yalom puts it, looking out of the client's window. Cultivating creative indifference. You don't ever know what is important to your client and what isn't until they tell you. And that is just as true whether they are autistic or not. I work with both autistic and non-autistic clients. Until about 2 years ago, I had worked almost exclusively with non-autistic clients. I do not find any difficulty in hearing what they are saying, looking out of their window, entering into their internal frame of reference. Or at least so the evidence would suggest. And that's not because it's my natural language or culture. Perhaps precisely because it isn't. One of my strengths as an autistic counsellor is that I do not assume. I have learned over a long roller coaster of a life that I can't assume. If I assume about neurotypicals, I will almost certainly be wrong. So I have learned to listen, to hear what the person is saying, rather than what I think they are saying. I have learned that because I have had to learn it. Otherwise, there is a constant clash of cultures, of languages, of neurotypes. A constant mismatch of salience. So listen, ask, communicate, don't be afraid. Check whether you have understood. Check whether you have been understood. Take it slowly. Give your client time to process and give yourself time to process. Remember that some of us struggle to speak when we are stressed, anxious, overwhelmed. Remember that most of us camouflage most of the time. Don't assume, ever. Maybe even explicitly discuss the double empathy problem and the differing communication styles. The problem is not so much that autists and non-autists can't understand each other. It is true that we don't do so naturally, but yes, we can learn. The difficulty is that you, the non-autists, have not had to learn, because you are in the majority. There isn't just a mismatch of salience, there is an imbalance of power. I recommend Nick Walker's piece on neurotypical psychotherapists and neurodivergent clients. I'll just quote a short snippet here. The 20th century political scientist Karl Deutsch said, "Power is the ability not to have to learn." Power is the ability not to have to learn. When a social system is set up such that one particular group is almost always in a position of social power or privilege over another group, the members of the privileged group never truly need to learn or practice empathy or understanding for the members of the disempowered, oppressed group. Nor do the members of the privileged group need to learn to adapt to the communication style of the oppressed group. And anthropologist Mary Catherine Bateson, writing about learning and power relations in colonialism, observed, "People who don't wear shoes learn the languages of people who do, not vice versa." Power, or privilege, as we now more commonly call the particular kind of power to which Deutsch was referring, is the ability not to have to learn. For so long we, the autists, have been seen as deficient, defective, lacking, without shoes, rather than simply belonging to another neurotype or culture. You have not realized that all you have to do in order to create understanding is to listen, communicate, ask. Do it our way in the therapy room, as we have to do it your way out there. I think what most autistic clients who have the experience of both autistic and non-autistic therapists would say is that with an autistic therapist, there are so many things that they do not have to explain, things that the therapist also experiences, also knows. Thinking patterns, processing styles, sensory sensitivities. I know that when a client closes their eyes, they are not bored or asleep. They are concentrating and shutting out irrelevant sensory experience. I totally get it when a client says, "I don't know what depression means, but I know that there's a black scribble on my left shoulder." I know that when a particular client starts telling a story, they have got to finish it, even if it meanders, because if any of it stays in their brain, it will be impossibly distracting. And so on. I could give you 100 examples. And yes, there is that autistic click, as I call it, when you meet a member of your tribe. Do you remember when Macs and PCs couldn't exchange files without converting them to RTFs and then back again? It's a bit like that. Converting is not a problem, but it's good when you don't have to. Some people say it's a bit like gaydar. I have certainly heard the word autstar. Maybe. So, regarding accommodations in therapy, a quick comment from Chris Bonello that I think is worth bearing in mind. When non-autistic people ask for things to be a particular way, then it's called normality. When autistic people ask for things to be a particular way, then it's called accommodation. You won't be surprised that the first thing I want to look at is communication, language. I have noticed that many therapists tend to use rather circumlocutory and often vague language. Maybe this is an attempt not to be directive, to be open, to leave as much to the client's understanding and initiative as possible. A therapist once said to me, I may be slightly misquoting, What would be the best way for me as your therapist to hold a safe space for you here? Well, I sort of know what that means, but I don't know how to answer, as I don't understand the frame of reference or what the therapist was actually asking or offering. Safe in what sense? Space in what sense? And when you say hold, you mean... So keep it straightforward and unadorned. If your autistic client likes flowery language, and some of us do, you'll find out soon enough. But what we don't like, and often enough don't understand, are circumlocutions, hints, and lack of clarity. So don't say, would you like to come into my office now? Say, come into my office. So clear communication. If you offer a certain number of sessions, say so. If you have a waiting list, we would rather hear, it will definitely be within 6 weeks, rather than, it's about a month. Specify exactly how we will be informed about our appointments and whether we will be reminded each time. In my private practice, I have clients whom I remind in the morning of our session and then again by text at lunchtime. Others simply turn up every week. If you are doing video or phone counselling, make it clear who calls whom. Make sure your client fully understands how to use the platform to lessen stress. You might like to look at chapter 26 of the Neurodiversity Reader, which is a book I wholeheartedly recommend to everybody. University through the eyes of autistic students and staff. There is a pretty comprehensive list of questions that autistic students might ask, and it applies just as well to the workplace and indeed to the therapy room. As the author says, the need for clarity is a recurrent theme. Ambiguous information and impenetrable administration systems can cause high levels of anxiety. Instructions that are not clear can make it difficult for a student to focus on an assignment because they are worried that they might be getting it wrong. Badly written exam questions and instructions cause a great deal of stress. Reliability is something that autistic students value. Over-promising and under-delivering creates confusion, so it really helps if people just do what they say they are going to do. At a systemic level, a culture of reliability is helpful. If, for example, a class must be moved to a different room, notifying all students in advance routinely via an agreed system helps everyone, not just autistic students. Having named reliable people is valued, particularly when the roles of individuals are unambiguous. Having a mentor to help with navigation between people, roles, and systems is something many students found helpful. In case I haven't said this often or clearly enough, don't be vague. Don't hint. Don't be subtle. In long-term therapy, there is space for misunderstanding, for ruptures, and for slow learning of each other's communication style. In short-term therapy, there isn't. If you aren't sure what your client means, ask. And tell them specifically. Don't wait for them to pick it up from the ether. If what I am saying isn't clear, please ask for clarification. We autists are so used to being misunderstood, to battling to express what is going on inside. And bear in mind that many of us have poor interoception and/or alexithymia, only to have someone either stare at us in bafflement or assume that we have said something quite different. Our feeling is that whether or not we lack theory of mind or empathy, neurotypicals most certainly do. As Damien Milton says, it actually goes both ways. The result may be that we stop trying, or that we tie ourselves up in ever tighter and more complex knots as we see that familiar "I haven't a clue what you're talking about" face. And do you know, your "I haven't a clue what you're talking about" face looks quite different from ours. Yours is the face of the majority, the way things should be, impatient, pitying sometimes. Ours is the face of the minority, despairing, trying not to despair of ever being understood. You can imagine how powerful an experience it is when a therapist actually listens. Bear in mind that we almost all have a history of being contradicted, corrected, rejected, told we are wrong, overreacting, being difficult, being rude, being arrogant. I could go on for hours. Don't be surprised if your autistic client takes a long time to trust you. They have good reason. If I had the running of a counselling service, I would give autistic clients, maybe all neurodivergent clients, at least one extra session as a matter of course, simply to allow for the differences in communication and processing styles. In my private practice, I am very accepting of last-minute cancellations because my client is overwhelmed, burnt out, recovering from a meltdown or shutdown, or aware that they will melt down or shut down if they need to cope with any more input. I realise that may not be feasible in a busy counselling service, but maybe just a little leeway. Regarding trust, transparency and congruence are particularly important to autistic people. Life is so uncertain, and it is natural that we want to know whom we're dealing with. I understand that everyone has different views on self-disclosure, but err on the side of more rather than less with us. One of our communication styles that is very frequently understood is saming. We are inclined to express empathy by offering an example of how we have experienced something similar. Neurotypicals see that as making it all about us, but it is not. It is intended to affirm fellow feeling and demonstrate understanding. Autistics understand that about each other, and we will really appreciate it if you do at least a little of it yourself. If nothing else, let us know, for example, that the pandemic has affected you too. In case you're feeling daunted by now, I honestly believe that a properly trained reflective counsellor should be able to work with human beings, and that is what we are doing. The issue is secondary. Everyone comes to counselling with a mismatch, an incongruence between what is and what we would like it to be. We need an openness to learn, a willingness to be corrected, and genuine, unconditional, positive regard towards every human being. I would much rather have a non-autistic counsellor who honestly says they don't know much about autism but knows how to listen, than one who thinks they are an expert. That's the communication in the therapy room. But there is more to counselling than the therapy room. We have to find our way there. I have said that completing a task with several steps can be a challenge for us because of poor working memory. Because many of us also have a different visual processing systems, we may find navigating buildings difficult. We tend to see details but not the whole. Remember weak central coherence? So it may be hard to scan a building frontage and see signage which may be very obvious to a neurotypical eye. We autists joke among ourselves about the nightmare of toilets in restaurants, pubs and supermarkets. Multiple doors are incredibly confusing. If you're not out in 5 minutes, we'll send a search party, is a frequent quip. Maybe give us a map? Not, however, a stylized map, as it is likely that we won't be able to connect the stylized map with what we see in front of us in the real world. A photo of the building frontage with "here is the door you go into," and the same thing for reception, if there is one, would make all the difference. Oh, and prosopagnosia, face blindness. Many autists find it very difficult to recognize faces. If you have a waiting room, and when you go to pick up your client, they just look right through you, say who you are. Just, "Hi Mary, Max here," will do. The more stressed they are, and the more sensory confusion there is in the room, the more likely that will be. If they are already dealing with an assault on the senses, plus anxiety, plus uncertainty, it is pretty likely that they almost literally will not see you. You may also have to speak to them more than once before they register that it is you and that you are talking to them. It is well known among my friends that if we meet in the street, I will apparently cut them dead. I, not literally, but figuratively, genuinely will not see them, because my brain is far too busy navigating the street and filtering out the non-essential from the essential, which, as you will already have gathered, is not something that comes naturally to us. Essential is not being run over and not walking slap bang into someone. Essential is not, oh, there's Fred who has the counselling room next to mine. Similarly, your client may constantly forget your name. Names, after all, are a meaningless collection of syllables until a meaning is attached to them. There is no reason at all why the counsellor should be Jim and not Mike. I'm used to my autistic acquaintances calling me Alex. Somehow they have connected me with the letter X, but they haven't quite fixed upon Max. People who know me better and know my family history know why I am Max. It is actually very significant, and they would never forget. Please don't expect your autistic client to find your counselling room without difficulty the first time. They will learn, of course they will, but it may take time. And similarly, don't expect them to find the waiting room and the exit. Go with them. If at all possible, use the same counselling room each time. I'm aware that that isn't always feasible, but if you know you'll be using a different room next time, tell them. Regarding the counselling room itself, you won't know what might be difficult about it until you meet the individual client. Don't assume that all autists will have the same sensory issues. Some of us will like low light, some bright. Some will like ambient music, some won't. Some will be bothered by the ticking clock. Unbelievably, some won't. Some will like scents, for example, an oil burner. Some won't. Some will like to sit on the floor or hug a cushion or fiddle with a fidget spinner or stone. Some won't. Ask. Be flexible. And something in me wants to add, but wouldn't we do this for any client? Maybe we wouldn't, and maybe we should. There is a really excellent section on adaptations to the environment and to the style of therapy. Some only applies to the fairly formal CBT, but the rest is relevant to everyone, in Psychological Therapy for Autistic Adults, published by Authentistic. I don't have time to talk about all the details now, and you will find a wealth of them there. If you don't read anything else on autism, read that and The Reason I Jump by Naoki. I have been asked a few times what I do when I meet a client who I suspect is autistic. Do I tell them? Do I ask them? It's a bit different in my private practice, as autism is my speciality, and most of my clients are either autistic or wondering whether they might be. But in other contexts, almost always, no. If the client is already using the language of difference, I may pick it up. If they leap on it with enthusiasm, I may pursue it. If a client says to me that they feel like an alien from another planet, I might ask them to describe their planet. Diagnosis is not my business. Seeing the client's world from their frame of reference is. So always follow the client. You will pick up soon enough if there is a question they really want you to ask. Sometimes, in this as in so many other things in counselling, you just have to take the plunge. You will know if your client has said everything except the word. If they have, if you can almost see it trembling on their lips, then say it. Anecdotally, most people diagnosed or self-diagnosed in adulthood experience the diagnosis as a huge relief, a revelation, a joy. It may take some adjustment, and there will almost inevitably be some element of grieving over how different life might have been had they known earlier. But that may well not be the case. The context is enormously important. I was lucky. I discovered that I was autistic in the company of a group of autistic women at a time when I had already turned my life around, had moved back home to the borders from Edinburgh, and was doing my dream job. The experience was 100% positive. Whereas if you were diagnosed by a psychiatrist to whom you had been sent as a result of a breakdown when everything in your life was falling apart, and you are presented with a medical deficiency model of autism, well, it's rather different. But I shall never forget the moment when I said, "So, I'm not mad, bad, and dangerous to know, just autistic." Yes, there is an element of grieving for how life might have been had one known. Authentic quotes one participant thus: "My immediate feeling on receiving my late diagnosis of autism was a feeling of overwhelming relief. My life was brought into sharp focus, reinterpreted in the face of this new knowledge. The intense self-criticism that has accompanied all of my self-perceived failings, when the challenge of my tremendous anxiety has resulted in feeling unable to achieve my ambitions and live the life of which I dreamed. I had always felt so innately flawed when comparing myself to others who managed with ease all the things in life that I found so difficult. But now I knew. I am not flawed. I was and have always been autistic, without myself or anyone else recognizing that fact. Secondary was a feeling of grief when I looked back over my life and with hindsight reflected how so many of my distressing life experiences, which triggered lifelong serious mental health difficulties, could be attributed to the lack of recognition of my autism and the consequent total absence of any adaptation or accommodation. I mourned for what could have been. Then, to disclose or not to disclose one's own autism. It's a question that autistic clients may well bring to counselling. Carl Cameron in the Neurodiversity Reader says, "To disclose one's autism is a deeply personal and complex decision to make, and once revealed it's impossible to take back. To mask or not to mask, that is the question. But make no mistake, whether you decide to disclose or mask, there is a risk attached. Revealing you're autistic may change others' perceptions of you, particularly professionally, and it may leave you vulnerable to manipulation and perhaps open to exploitation. Non-disclosure leads to a life of stealth, pretense, exhaustion, and a life in which no adjustment is made, when no one has any idea you are struggling." Whether or not to disclose depends also on how a person feels about their own diagnosis. We all know about internalized homophobia and internalized racism. Internalized ableism is at least as strong. A lot will also depend, as I've said, upon the context in which the diagnosis or discovery was made. Ultimately, everyone has to make the choice for themselves. You can't tell your clients what to do. What you can do is work to make this world, as Naoki says, just a little more autism friendly, so that what we disclose becomes an acceptable and indeed valuable difference, not a deficiency and a stigma. I will give Naoki the last word, as I gave him the first. I can't really imagine myself as not having autism, because the myself I'd be wouldn't be the same myself that I am now. A me without autism, even one who looked exactly the same, would have an entirely different set of ideas and way of looking at the world. Losing one's autism wouldn't be quite the same as recovering from an illness that has temporarily crippled one, for example. It isn't a case of a disease being cured or an injury being healed. It could well be that our brains are wired in different ways. How would you feel if you were obliged to undergo medical treatment for the sole reason that the person you are is an inconvenience? Not medicine to alleviate symptoms, but an operation to effect a root and branch change to who and what you are. and remove all meaning from everything you thought was beautiful and precious. I love nature. I have an interest in letters and numbers, and I am fascinated by some things that other people have no interest in whatsoever. If these fascinations are rooted in my autistically wired brain, and if neurotypical people are unable to access these wonders, then I have to say that the immutable beauties of autism are such that I count myself lucky to be born with the condition. That's Naoki, and I agree with every word.